get outside. The role of transient microbes from the natural environment on the health and function of the skin cannot be overstated.
Welcome to the Dutch podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. This information is not to be interpreted or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, and treatment. Welcome back, everyone. I'm so excited you're here for joining us at the Dutch Podcast Live at A4M. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at the Dutch Test, and I hope you've been with me all day. We're trying to give you a little bit of a taste of all the fun, amazing, brilliant guests that we've had at A4M here. Today's guest, this afternoon's guest, is no different. Kiran Krishnan, really someone who's made a lot of impactful changes to our industry, really got us thinking a lot about the microbiome, which we know is something that's so critically important. And we're going to be talking today about the skin microbiome, which is something that is really making a huge change, even in the conventional space around, toothpaste and skincare lines. And we're starting to actually think about products being disruptive or supportive to the microbiome. So let me just introduce our guest. Kiran is a research microbiologist and really an innovator in the functional medicine industry with over 15 years in microbiome science. He's the co-founder of Microbiome Labs, which is now huge. You must be really
nice
proud.
Booth,
pretty
right?
mad. And a pioneer of spore-based probiotic therapeutics, which I think a lot of you probably are using in your practices now. You have multiple patents, a lot of published studies, and really you've really dedicated your life to this global education of the gut microbiome and that complexity of the microbiome with things like immune science. And you've made it so easy to access and to learn. Thank you for all the work you've done.
Oh, thank you. It's my pleasure. And I'm really excited to be here. Thank you for having me. And it's fun to do it live because we've had a conversation before, but we've had to do it online. So this is great.
Yeah, this is great. And so I want to start by just talking about the skin microbiome.
Yeah.
What would you give, especially clinicians, as a primer as to why they should care about the skin microbiome?
I became really interested in it because I'm obsessed with barriers, right? 15 years ago, so I became obsessed with the gut barrier and understanding leaky gut and intestinal permeability and the clinical impact that it has on patients. When you start digging into it, what you come to find out is that maintenance of the barrier in the gut, for example, is highly determined by the types of microbes that exist in the gut. And when that becomes dysfunctional, when the microbes and the ecosystem of the microbes becomes dysfunctional, you get barrier dysfunction, and then that becomes very clinically relevant in disease pathology. So then that starts the wheels turning and thinking, okay, what are the other barriers in the system, right? And the skin, of course, is one of the largest barriers. And there are tons of microbes on the skin. There's 35 times more microbes than there are skin cells, right? And so the microbes seem to play a very important role on the function of the skin as a barrier. And if the microbes become dysbiotic, there's a very clear path to how the skin barrier becomes leaky and becomes dysfunctional. And then now there's a 65-year-long study, which is still going on, that illustrates that when the skin becomes leaky and the barrier of the skin compromises, it becomes an independent risk driver for chronic disease.
Wow, that's fascinating.
Which is crazy, right? You wouldn't think that. So this is called the Baltimore Longitudinal Study of Aging. It's a 65-year-long study, still ongoing, that was something like 3,800 subjects. It's the first and only longitudinal study of aging, which is fascinating. They took subjects who were in their early 20s and late teens, and they decided we're going to follow them for the next 80 plus years until they die, right? And we're going to measure all kinds of things along the way. We're going to look at all the choices that they make and how it impacts them. We're going to look at mechanisms from a cellular perspective, from a metabolic, and so on. They looked at everything on these individuals to understand what was driving risk and of morbidity and mortality, right? What they found, and this is one of the most interesting conclusions, was the best predictor in all of the things that they found of morbidity and mortality was aged skin.
Age skin.
Age skin, right? And how do you define age skin? Well, they're talking about fine lines, wrinkles, dryness, thinning of the skin, hyperpigmentation, right? And so pigment, dysfunction in the skin. So you get all these different colorings of the skin. So then someone like myself and maybe even you might think, well, okay, that makes sense because maybe the skin is a reflection of an unhealthy inside,
Right.
right? But they showed that not to be true. What they found was that the aging of the skin precedes any sort of biological markers they could pick up internally of disease process,
That's
right?
fascinating.
So the skin dysfunction occurs first.
Yeah, I mean, I think about like the implication of like smoking on skin. I mean,
Yeah.
when you're walking around, you can tell who's a smoker and who's not once people hit maybe 50s or 60s.
Exactly.
So I can see what you mean where there are these dramatic changes due to things like oxidative stress levels in that example.
Yeah.
That you're seeing those changes. Tell us more.
Yeah, so here's what we're actually finding out, right? And I'm not part of these studies, so I'm speaking collectively
Yeah.
as somebody that's been following this work. That when the skin barrier becomes compromised, antigens and so on penetrate through the skin and end up meeting the immune system in the periphery. The immune system is really poorly designed to develop any sort of tolerance when it meets antigens in the periphery, right? All of the tolerance factors occurs when you meet antigens through the gut, through the mucosa, through sampling with dendritic cells, through upregulation of Treg cells, all in the context of the gut microbiome, right? Then we can develop oral tolerance against, say, food antigens and environmental antigens. If you take those same antigens and you penetrate the skin with it and it meets the immune system in the periphery, what you get is an aberrant response from natural killer cells and eosinophils and basophils, and you end up with this amazing hypersensitivity response throughout the body to those antigens, right? So that's one of the pathologies that seem to be occurring. Now, this is actually really well documented in kids.
Okay.
Atopic dermatitis, which is super common in kids, right? Which is driven by skin dysbiosis, an overgrowth typically of Staph aureus on the skin, and then a sequential dysfunction or dismantling of the barrier system of the skin. In those kids with atopic dermatitis are 8 times more likely to develop allergies, food sensitivities, and allergies, right? And they call it the atopic march. So what they've shown is, for example, peanut antigens. If peanut antigens enter into the skin and end up in circulation, those kids have a very high likelihood of developing severe anaphylactic and inflammatory response against peanut antigen.
Interesting.
Yeah, and they've mimicked some of these studies. They've done it on like dogs, for example.
Right.
Shaved dogs, rubbing peanut antigens on their sensitive skin, and then looking at immune responses internally to those antigens that are penetrating through the skin, right? So that's a great illustration of when things are allowed to penetrate through the skin that normally shouldn't be, it can create a profound inflammatory response. Another example of that, which is kind of freaky, it's kind of scary, they're finding that one of the independent risk factors for Alzheimer's is skin dysfunction, especially in the face and neck area. Right? Malassezia overgrowth, for example, right? Fungal overgrowth. And antigens from the fungus actually penetrating through the skin and entering into the central nervous system, eliciting an inflammatory response that damages the central nervous system, right? So now that's an independent response. They can show psoriasis, proteins in the psoriatic lesions found in the bone driving osteoporosis.
Wow.
Right? So the skin as a barrier, which is the most important function of this largest organ in our body, when that barrier system falls apart, it drives disease risk. And that barrier system is determined, or the barrier function is determined by the microbes that exist on the skin.
Yeah, let's pull this to the microbiome because it's so interesting. I mean, it seems like there are a lot of things that could damage skin and make it, have less integrity.
Right.
I have so many questions, I don't even know where to start. So let's talk a little bit about the role the microbiome plays first in protecting the skin.
Yeah. So you've got resident microbes and transient microbes on the skin. Resident microbes are typically the microbes that are there permanently. Their numbers don't really shift a significant amount unless something catastrophic happens, right? Like you're bathed in benzoyl peroxide or something like that. Or for women going through, a C-section, for example, you're basically sitting in antimicrobials for a long period of time, or people that use really strong antimicrobials as a way of cleansing themselves all the time, soaps that with the addition of antimicrobials, right? Or antibiotic creams and all of that.
Right.
So those can all create real detriment to the resident microbes. So the resident microbes exist on the skin, and then there are transient microbes that you're supposed to pick up from the environment. Those transient microbes can have a very beneficial effect on both the resident microbes and how the immune system responds to stimulus on the skin, right? So there is a tolerance effect of natural environmental bacteria. When they jump onto the skin, in conjunction with the resident microbes, they train the immune system in the dermis and the epidermis to not respond to certain stimuli. Just like in the gut, the microbiome can train the immune system not to respond to food antigens and all that are coming in. There is this immune tutoring that seems to occur on the skin, right? So that's one aspect of the barrier function. It's priming and training the immune system not to overreact to things. The second part of it is the actual structural elements of the skin, right? So the expression of collagen fibers, right? And then looking at the ceramide layer, which is a mortar that sticks all the skin cells together that creates this hydrophobic layer that's really, really important. And then on top of that is the pH maintenance of the skin. We all know, for example, that pH is so important to the health of the skin, right? The healthy pH of the skin is between like 4.5. So it's more acidic than anything. If it goes up, what tends to happen is you have high risk of fungal overgrowth and issues that stem from that. So then how do we maintain the pH of the skin, right? It's such a critical feature. We have such a narrow window of what's a healthy pH. We don't have a way of maintaining that pH, right? We're not putting hydrochloric acid on our skin like we do in our stomach. It's the microbes. The resident microbes take the oils that are being produced on our skin and excreted, break those oils down into fatty acids, and those fatty acids maintain the lower pH of the skin, right? So the pH of the skin, the immune response on the skin, the structural elements like the collagen fibers and the elastin fibers, the ceramide layer, which creates the hydrophobic lipid barrier on the skin, all of those components are dependent on microbes on the skin.
Well, it seems like we do a lot of damage to our skin just through like the activities of daily life. And I think they're starting to shift away now culturally, but I think about the obsession with hand sanitization.
Oh, yeah.
Can you talk a little bit about that? Because it seems like the hands, one, they show aging very early. Because even for people who are using sun protection, we don't think of our hands, but they're constantly exposed. They're also probably exposed to the most microbes of any part on our body. And then they're also exposed to probably the most antimicrobials, like leaving susceptibility to damage. Have you seen data or do you have opinions on all the hand sanitizers and the impact that may be having?
Yeah, absolutely. So, one of the wins in this whole space was the removal of triclosan from a lot of
which was an endocrine disruptor as well.
Exactly, right?
Huge issue.
And it's such a broad spectrum antimicrobial. And it has a double whammy, and a lot of antimicrobials, including all the alcohol-based sanitizers, have a double whammy because not only do they virtually sterilize your skin microbiome, right? So they're knocking down the microbes 95%. So it's like a one log reduction, we call that, right? So it's 90% plus. On top of that, they dry out the skin as well, right? Which is then the next step that usually occurs in barrier dysfunction. It's like the dysbiosis from changing the microbial environment, and then the dysbiosis will often lead to drying out of the skin because the dysbiosis causes a ceramide layer to break apart because the microbes are needed for the ceramide layer. And the ceramide layer is what keeps the evaporation of moisture away from your skin. Because it's a hydrophobic layer, it doesn't allow moisture to come out, right? And so, but when that ceramide layer is broken up, you get a lot of evaporation and the skin becomes dry. That starts to create the penetration or the barrier dysfunction. Alcohol does that in one step.
I was going to ask, alcohol doesn't seem like it'd be any better for that ceramide layer.
No, it's not. And in fact, anything beyond a gentle soap for cleansing of your hands or any part of your body is way excessive.
Yeah, and I see now a lot of soaps even are like they talk about maintaining pH or maintaining microbiome. Should we be looking for things like that to use?
We should to a certain degree. Now, most of them, from what I've seen, don't actually have any studies in place to show that it is friendly to the microbiome, right? Real old-fashioned soap that's just made from fats, surfactants, right? they're perfectly fine.
The old
You know,
school.
the old school,
Go old
right?
school. They
Go
had it
old
right a
school.
long time ago.
Yeah, and I mean, I use, for example, and some people who are very skincare conscious cringe that I use like just a good old bar soap on both my face and my body and all that, right? And it's like a very minimalistic bar soap that basically has like 4 ingredients in it. But that's really all you need. You
It's
need
like
a
a
light
fat
surfactant.
lye, you know, all the kind of traditional means.
That's exactly right.
That's
Yeah.
great.
That's really all you need. And you don't want any fragrances in it either, right? Because one of the things that the studies are starting to show is that most fragrant compounds are volatile compounds, and those volatile compounds have strong antimicrobial effect.
So one of the things I think about is like with oral microbiome, there's such interesting information because it seems as though like microbes themselves, or they can actually enter the bloodstream, transport to other areas, cause problems. Is it similar with the skin?
That's exactly right. Yeah.
Okay, can you describe that? Because I think it's hard to comprehend.
Yeah.
That a microbe could enter the bloodstream because of the size of what you'd expect it to be.
Right.
That how it can migrate to other areas or cause other dysfunction. The immune, like cytokine-driven reactions, those all make sense.
Yeah.
But actual like migration of microbes or microbial proteins,
yeah,
it's harder to wrap your head around that.
Yeah, and it makes sense because we get very comfortable with the idea of our barriers functioning as barriers, right? But what we don't understand is that little microscopic changes to the barrier can create channels in which microbes can penetrate through. So a good example of that. We have, of course, the stratum corneum, which is the topmost layer of our skin, a lot of dead skin cells. Then we have the epidermis, which has multiple layers, and then the dermis, of course. And now the epidermis and the dermis both have capillary beds, right? Hence, amazing reactivity. You rub your skin a little bit, it gets red. Those capillary beds are actually loaded with immune cells as well, right? A lot of the redness is the degranulation of mast cells in there. And so just friction can create mast cells to degranulate in your skin. So it shows you how close the circulation in the capillary beds and immune cells are even to the surface of the skin, right? So if you start compromising the surface of the skin, so you're exfoliating too much, for example, or you're using stripping agents or acids, and a lot of people do this, right? They're stripping their skin, they're exfoliating almost every day or every other day, or your barrier is dysfunctional in one way or the other. It's just a few cells down before you get to a capillary bed. Now, one of the things that tends to occur when you have an area of your skin where the barrier is compromised, you get small molecular toxins that penetrate through and continuously irritate that area.
Causes more damage.
Causes more damage, right? So the inflammatory response in itself causes more damage. One of the ways in which it causes damage, which we don't talk about enough, is the damage that it causes to those microvessels. Right? Inflammation causes endothelial disruption to the microvessels, which actually makes the microvessels porous.
More permeable.
More permeable. And those microbes can actually enter those microvessels, make its way into circulation. Now it's in the superhighway, right? So it can make its way throughout the body from that spot. And you can see this as there's studies that have actually shown this. You can find skin-based proteins, microbes, microbial components in areas that are distal to the site of action, like in the bone, in the brain, and so on, right? So it's really fascinating. We do make a lot of assumptions that our barrier is acting as a barrier, but often it's not.
You have me thinking about that a little more, like thinking about barrier integrity, and you know, of course, these things all make sense. But when you think about the risk that it poses when you don't keep the outside and the inside inside. You know, they are mounting more and more when we look at all of the different microbiome.
That's right.
In the body.
Yeah, absolutely. And then the immune system becomes confused, right? It's having to deal with things that it normally doesn't deal with in areas it normally doesn't deal with. And the immune system's default mode is like, let's just go haywire, right? It as a last ditch effort to protect the system. It basically deals with everything as if septicemia is coming along, right? So it's like, it just goes nuts. And we've heard about this during COVID, about the cytokine storm and all that. That can be induced in all of these areas where barrier function becomes compromised. So we forget, we think about our skin more often as like how we show up in the world, right? Our veneer. This is what we look like. And if our skin is not looking as healthy as it should or as good as we'd want it to, cosmetically. There's a lot of things you can do to make it look better, right? There's injections and Botox and this, that, and the other, masks that we can wear as makeup and things like that. And our thoughts on skin have been always on the appearance of it,
the visual.
right? The visual, but we can fake what the visual looks like. What we cannot fake is whether or not the skin is healthy. So part of my goal with some of my new things that I'm focusing on is how do you make skin look better by making it healthier?
That makes sense. It's that inside out approach.
Yeah.
Are there things, I'm like kind of jumping ahead, but I'm so curious about this. Are there things that are trending right now in skincare, whether it's red light therapy or other things that could actually be backfiring because it's harming the microbiome?
That's a good question. So when I look at the world of aesthetics and med spas, it does make me nervous when they do a lot of microneedling.
It seems like there's so much. Yeah, you think about microneedling and the impact of like those actually go down to the capillary bed. The entire point is to make the skin penetrable to whatever serum that you're going to put on.
Right.
And so absolutely that seems like it could be problematic.
Yes, and all the injections, right? All of that are barrier breaking. I had a great conversation with a plastic surgeon who's starting to come around with the idea of like, I don't know if what the things I'm doing are actually good for the skin because overall I'm breaking the barrier consistently, right? And in an unusual way. So, and all of the stripping, right? So of the skin, the overt exfoliation, the acid, exactly. All of that. Like, the idea is that, if we strip the layer of the skin, we'll get new skin coming about, right? Like we're a snake shedding its skin and the new skin is showing up. But we're also stripping so many functional elements of the skin when we do that. And whether or not it comes back healthier is a little bit of a crapshoot.
It probably depends upon the environment that the person is in, but it does seem very risky. I think about the laser treatments that end up with like severe redness and inflammation, and that barrier is so disrupted, it's almost like scabbing.
Yep.
Exactly. It's something that so many people are doing, and they love the result of it. Yeah. But it does seem like it's pushing the reset button. Yep. And if you didn't do the pre-work, you might be in trouble.
Absolutely. And I think, more often than not, as a society, we give in to short-term benefit and kind of ignore what the long-term issues may be, right? You take, even in the world of diet, you take the carnivore kind of diets and the keto kind of diets. It's like, yes, there's short-term relief from the issues of intolerance of certain types of categories of foods. But that's not a long-term issue, and that has long-term consequences, right? But the short-term relief always wins out in these cases. And so often with the skin, that's exactly how people think.
Well, I think even especially with the skin, more than most other conditions, the short-term wins out. Skin and hair. I've never seen women in my practice more concerned about any condition than skin conditions and hair conditions. Yeah. Because that's the way we are, it's our face to the world. It's how we interact with the world. So that makes a lot of sense, but at the same time, it's probably a place where women may take, or not just women and men, may take more risk to try to attain the results thereafter.
Yeah, absolutely. And you see that in many conditions like acne, for example, or dermatitis. I did a bunch of work in acne even when I was at Microbiome Labs, and then even now, because it's such an interesting example of a number of things that can coalesce together to create a problem. And then, of course, which we look at inflammatory lesions on the skin, right? Nobody wants pimples, and no matter what age you are. But then often the solution will create more problems down the road, right? Of course, the most prevalent solution is our antibiotics, both topical and oral antibiotics, right? And long-term antibiotics in many cases. And so that is like another great illustration of like, okay, there is a mechanism in play here that is creating this inflammatory lesion. And if we kind of look at root cause drivers, we can likely reverse it, which we've been shown to do in clinical trials. But we're taking a very different approach that actually has a more harmful trajectory to the skin.
We'll be right back with more.
Join us this March at Dutch Fest in Dallas, Texas, where you become the hormone expert. If you're a registered Dutch provider, this is your invitation to 3 days of advanced hormone education, clinical insights, and hands-on case study-based learning. From March 12th through 14th, learn directly from founder Mark Newman, Dr. Jacqueline Smeaton, and Dr. Carrie Jones as you dive into focused sessions, discover real clinical applications, and explore practical testing strategies you can use immediately. The goal of Dutch Fest is to learn how to interpret the Dutch test with speed, confidence, and clarity. Spots are limited. Registered Dutch providers, secure your ticket now through your provider portal or by visiting DutchFest.com.
Welcome back to the Dutch Podcast.
I'm glad you brought up acne. Are there specific microbial patterns that tend to be seen with acne?
Yeah, so we have to treat the face and the body as almost two different organs, right? From a microbial standpoint. So the face is a highly sebaceous environment. It's very oily. There's a lot of crypts and things like that. Because of the high sebaceous environment, the face tends to have very low diversity. Right, you typically have a few different species of Cutibacterium, and then there's some Propionum bacterium as well, and Staph epidermidis. The rest of the body, for example, the back, the arms, the legs, are much more dry environments, and it tends to have really high diversity. You can have upwards of 1,000 different species living on your arms and legs, right, which is amazing. And so when you start to understand dysbiosis on these two different parts of the body, it's exactly the opposite. So face dysbiosis is an increase in diversity. Skin dysbiosis is a decrease in diversity, right? And so talking about acne then, right? So typically what happens with acne that starts to trigger a dysbiosis and then starts to increase risk for developing lesions is you start to see a reduction, an increase in diversity and a reduction in the predominant microbes.
Which are probably the protective.
The protective microbes, right? And there's Cutibacterium acnesis. There's a number of different versions of them. There are some that are very inflammatory and can trigger comedone development. And then there are some that are protective. So Cutibacterium is kind of a confusing microbe, right? Because you definitely have versions of it that cause acne and versions of it that prevent acne. And then there's a couple other Propionum bacterium, and there's some evidence that your Cutibacterium and how it reacts with Staph epidermidis is the really important determining factor in whether that Cutibacterium becomes aberrant and starts creating an issue. So you've got this predominance of Cutibacterium and Staph epidermidis. Then you do all these horrible things to your face, right? Constantly antimicrobialing it, overwashing, over-cleansing, swiping it, cleaning it, stripping it, all of that stuff. And as those two microbes keep getting knocked down, you start to get aberrant growth of microbes from other parts of the body. You can actually transfer microbes as from your hands, for example, as you're touching your face, you're transferring microbes now to your skin on your face. And you're seeing a diversity increasing, Staph epidermidis going down, and as a result, you start to see a shift in the type of Cutibacterium becoming prevalent. That type of Cutibacterium gets into the pores and can trigger an increase in sebaceous gland activity, causing more sebum production and a clogging of those pores. Now, when you trap that Cutibacterium in that pore, you trigger a massive inflammatory response, thereby creating an inflammatory comedone. Right, and acne is often thought of as an infection. Erroneously, it's not. It's an inflammatory condition.
I'm glad you make that distinction because bacteria, like you're describing, they're involved.
They're involved, yeah.
But it's not necessarily infectious the way we'd think about it.
Right, it's not. It's a bacteria. Bacteria is triggering an inflammatory response in the body. There are components from our gut that can get involved as well.
I was just about to ask that. I mean, is there like this gut-skin connection? I know there's providers, like Julie Greenberg comes to mind for me. She's had incredible results in her dermatology practice working on the gut microbiome. And I find that so fascinating that she says now she can take a look at someone's skin and kind of predict what she's going to see when she does GI testing. Yeah. I'd love to hear your point of view on the connection point there.
Yeah. Actually, I have a patent on this, on a probiotic way of alleviating acne, both inflammatory and non-inflammatory lesions. It's actually one of the last patents I was able to develop at Microbiome Labs before I left. And so the hypothesis was simple. So there's about 52 studies that look at dietary impact on acne, right? What's really clear is in most individuals who are susceptible to acne, and I think you have to have a topical susceptibility too, which is that dysbiosis,
Okay.
right? And then the internal part can drive and increase the risk. And then, of course, there are hormonal components as well, which we can talk about. But let's say they already have the topical risk. They're seeing an increase in the diversity of the skin on the face and neck, and then they're seeing that shift in Cutibacterium, the type of Cutibacterium. Now you add to that stressors in the gut. So in this case, they looked at gluten and dairy, and what seems clear is that foods that are high in dysfunctional fats, so like fast food, processed foods, gluten and dairy can drive acne in most individuals. And what they found is that foods that follow more of the Mediterranean diet seem to alleviate acne, right? So what that indicates to me is that foods that increase endotoxemia, LPS, are likely causing more impact on acne. So first line that we looked at is there a correlation or connection between leaky gut and LPS endotoxemia and acne? And sure enough, there are at least 4 studies that show in individuals who are susceptible to acne, if their serum levels of LPS increase above a certain threshold, you can find LPS interacting with the sebaceous gland, triggering more inflammation. Right, so LPS was a trigger that kind of broke the camel's back that caused the formation of the comedones. They're already susceptible, but that became a trigger.
So
right?
really, if you were going to break that down to simplify it, the gut dysbiosis is leading to kind of this inflammation for LPS that's causing greater susceptibility in other microbiomes.
Exactly.
Okay.
So if you think about the skin has now structurally and ecologically been primed for developing acne. And then the gut becomes the driver of it, right? And if the gut, so in those conditions, if you're structurally and ecologically primed for acne, but your gut is perfectly healthy, you don't have endotoxemia, and you don't, there's another component I'll talk about. If that component is functioning, you will likely not develop lesions, right? It seems like acne, you have to have both components. So the other component of it is we were looking at short chain fatty acids and their impact on acne. What became clear is that individuals that were protected against acne were individuals that had high acetate production. And acetate is an interesting component of the short chain fatty acids because it leaves the gut more often than butyrate and propionate does, right? And you find it in the periphery, in skin, and what we found is that there's data that indicates that acetate can actually reduce the amount of sebum production and act as an antimicrobial inside the pore itself, right? So our hypothesis, which is what we were able to develop the patent on, was if we design a probiotic that stops LPS and increases acetate production, we should be able to significantly reduce acne lesions. So we ended up doing 2 clinical trials. The second one is a much larger, became the largest probiotic acne study ever. And it was a 90-day study, and we saw on average a 75% reduction in both inflammatory and non-inflammatory lesions.
Wow.
Just with the probiotic.
And that's just really by altering the gut microbiome.
Just by altering the gut microbiome. What we did in the placebo group, we did, because everyone has a skin routine, so we kind of gave them the same skin routine. We gave them the same cleanser, the same toner, same moisturizer. So everyone used the same topical treatment. The only difference was whether they were getting the probiotic or placebo. And a 75% reduction is on par with doxycycline or any kind of antibiotic treatment.
And yet, and you're doing that through building, not through knocking things down.
Exactly. And so, we're absolutely building. We're making the skin healthier in that regard. We're making them healthier because we're reducing leaky gut, which we know impacts everything. And then we're increasing short chain fatty acid production, which improves all kinds of things as well, right? So overall, they're becoming healthier, and thereby it's showing on the skin as clearer skin.
Can you talk a bit more about the population of patients that's best suited for? Like I think about hormonal acne during puberty. Does it work during that time, or is that hormone contribution a different mechanism layered on?
So we've done some work on this as well. Hormonal acne is a little bit harder to deal with than people that have non-hormonal acne. And cystic acne is also a little bit harder to manage. But nonetheless, we do see effects in both as well, right? Okay. With hormonal acne, it seems to be more important on your timing of things, right? Because it's associated with cycles. We know that in the luteal phase, we're going to see potentially an increase in acne because estrogen is dropped, of course, and androgens are going up.
Right. Relatively, yeah, for
Relatively.
sure. Yep.
And as a result, of course, you see the characteristic around the jawline and so on. So then the question is, well, why is that? Well, androgens tend to stimulate more sebum production, right? And they can create more inflammation. So then, like, okay, if you determine that, and that's where a Dutch test comes in, really beneficial, is because you can then correlate your expression of acne lesions and the development of lesions to your cycle and what's actually happening. You can figure out, A, is it driven by an androgenic response? B, is it androgenic and a cortisol response? Because we know stress also can induce it, right? So you can look at the cortisol pattern as well. And so you can align your acne issue with patterns.
Yeah.
And as a result of that, you can be more proactive, right? So if you're going into luteal phase, right, you want to be much more sound on your diet.
Maybe sleep more.
Sleep more, right? You want to increase fiber intake. You want to get more short chain fatty acids going. You want more acetate going up. You want like less dairy, less gluten. You want to be really clean about those things. The studies on acne and diet show that polyphenol intake in the diet has a massive improvement on acne lesions. So you want to increase your fruits and vegetables and all that as you're going into your luteal phase, right? If that's what you've mapped it out. Or if it's just purely a cortisol response, right? Then, because some people will have stress-related acne, which can occur, but stress creates leaky gut, and that's probably the main mechanism in which it's causing acne, right?
Yeah, it's interesting because women tend to have more, we actually have more androgen receptors in the skin cells around our jawline and neck as well in some women. So it's really, I think, thank you for bringing up the Dutch test. We love talking about the Dutch test on the Dutch podcast, but it is really nice because it seems like it layers in with this microbial approach because you will have, particularly if women make a lot of DHT, they are metabolizing their testosterone and DHEA down those alpha pathways, which produce much stronger androgen metabolites. They could be at that extra risk of making more sebum, causing more problems like you're talking about. It all connects.
Well, and we talked to, I have a skin serum product, which is a spore-based skin serum that seems to really help with acne. And when we find resistance in its ability to help, one of my recommendations to the clinicians that are using it is like, do a Dutch test and figure out the pattern, right? Because there may be a pattern to this that you're not seeing, and you want to understand that, right? Because then it's a slightly different approach that you would take.
So we've talked about aging skin. We've talked about acne. I want to talk a little bit about inflammatory skin conditions, because that seems like the other category where you get a lot of barrier disruption. You mentioned psoriasis. We've talked a little about like atopic dermatitis. Can you speak a little bit to those conditions? And it's hard to lump them all together, I know, because they're a little different. But talk a little bit about that and how a microbiome-based approach might help.
Yeah, so we've actually done a lot of work on atopic dermatitis, and for a couple of reasons. Number one is that the existing treatments for it are not great, right? Steroid creams are really the go-to. And then we've started 2 studies now on pediatric atopic dermatitis in particular, because of that atopic march that I talked about, right? So imagine a kid who's, say, 6, 7, 8 years old and has, bilateral atopic dermatitis. They have lesions on both arms and legs and so on. It's really irritating and difficult for the child at this age. But the bigger impact is that that's going to create lifelong sensitivities because of the atopic march. And they're just not managed well, right? The first line actors in this are the pediatricians. And I've talked to dermatologists about it, and they're like, pediatricians do not know how to handle skin issues. But there are very few dermatologists that also deal with pediatric dermatitis, right? So we started looking at this and go, okay, there's clearly a microbiome role here. Because with atopic dermatitis especially, it's really clear that an overgrowth of Staph aureus is a determining factor of whether or not an individual will develop a lesion in that area, right? But they have areas of their skin where they're not developing lesions, right? So I started this in the crudest way. starting this, having people do autologous transfers,
Okay.
right? So I'm saying, okay, you've got on this hand here, you've got a dermatitis lesion. This hand seems fine. So the microbiome on this hand must be okay. This thing, for whatever reason, you've got too much Staph aureus. So I said, clean this area really well where you've got the lesion, assuming the skin's not overtly broken and all that, but clean it with a nice gentle soap. And then take a cotton swab that's wet with a little bit of like olive oil or something. Scrub the healthy area and transfer it to the good area, right?
It's easier than a fecal transplant.
It is, and certainly easier fecal transplant
Yeah,
from somebody else,
that's
right? And so I said, just do that, like a few cases, just to see if that even makes any difference. And we were seeing some really profound results from that, right? It's a little bit more difficult for people to do on a regular basis, but just that autologous transfer, we're changing the microbial environment here, started to see a significant improvement here. So to me, that became clear that, okay, that the microbial trigger is so important, right? So then we developed that serum, which is a spore-based serum. We've done the spores in the gut. We know the spores are really good at competitive exclusion. So we said, can they do it on the skin as well? So we started treating these lesions with the spore-based serum, and we're finding amazing results so far. Right, so now we know that if we can shift the microbiome on the skin, at least in the category of atopic dermatitis, those type of inflammatory conditions, we can likely, subdue that response.
I'm glad to hear this because I think this is an area that's been a struggle to treat, even with integrative medicine. I mean, when I learned in naturopathic school, everything was like, it's a food allergy, it's a food allergy, but the data has not played out that food allergies are a consistent role in atopic derm in kids. And in fact, the data doesn't really suggest that it has any kind of meaningful incidence that's higher in atopic derm kids with atopic derm compared to a control population. So it's great to hear about other mechanisms that we may be able to think about to support these children and to prevent them from having to do these drastic elimination diets.
Totally, yeah, absolutely. And in fact, if there is a connection with food allergies, it's the food allergies result from the atopic dermatitis, not the cause of it, right?
It's so fascinating.
So it's the presence of microbes on the skin that are triggering aberrant immune responses. And then if you pair that with a dysfunctional gut, that tends to create this like massive NF-kappa B type of response to every trigger, then you get this perfect storm of a negative trigger and then a gut that also responds overtly to that trigger.
Well, I'm sure everyone that's listening is now wondering, well, this is amazing. What do I do about it? So can you tell me what foundational strategies clinicians should start with their patients when it comes to preserving skin barrier function? Yeah,
there's some surprisingly simple things to do, right? So number one, I would say start a process of trying to clean up most of the personal care products, right? If your patient's got products with a bunch of parabens and phthalates and all of that stuff in it, benzoates and all that, all of those preservatives, and I'll try to clean those up because those are all strong antimicrobials that are going to be killing off any beneficial bacteria in your skin. So let's reduce the killing. Right? So that's step one. Number two, replace those, of course, with as clean of products as you can. It doesn't have to be overwhelming. Start with something simple. I started, for example, with my moisturizer. Like, what is the cleanest moisturizer I can find that works for my skin? Then I went on to like deodorant and went on to soaps and so on. Number two, if it's somebody that uses makeup, make sure they are removing the makeup the moment they get home.
I'm so honestly like really bad about that. Not like anyone listening to the podcast cares, but I'm like one of those people that's so tired I want to get home and just hit the pillow.
Yeah, exactly, right? You want to remove that makeup. You want to reset the skin microbiome. You don't need to harshly, there's things you need to do to remove the makeup, but beyond that, you want to clean and moisturize the skin, right? And number three, you want to use at least once a day more skin mimetic moisturizers. What that means are these are anhydrous moisturizers that don't have water in it.
Okay.
Moisturizers that are predominantly things like squalane or linoleic acid that mimic the oils on the skin that are really moisturizing and also protect the microbes on the skin.
Okay.
Right? Another thing you can do is at least a few times a week, if possible. Go with stripped skin, and when I say stripped, I mean no product on it, right? Except for moisturizer. Get outside. The role of transient microbes from the natural environment on the health and function of the skin cannot be overstated, right? People pay thousands of dollars to do mud baths and things like that, right? And soak themselves in tubs. All you have to do is actually go out for a walk with no makeup on and no anything on, with this clean skin, and interact with nature, right? Just the microbes in the air alone settling on your skin can have a very modulatory effect, right? And then using serums, like we have the serum with the Bacillus endospores in it, that can be helpful as well for a lot of people. And then finally, cleaning up the gut, right? The gut is going to play a role in driving pro-inflammatory responses on the skin. So if your gut is leaky and you have low short-chain fatty acids, that's going to have a negative effect on the skin. So fixing the gut also helps quite a bit.
I love that, especially, we didn't get a chance to talk about it, but I've always been fascinated by the data showing that health is better in people who grew up on farms versus in cities. And I think about skin health as well. And I love that recommendation to kind of get out in nature and don't be afraid to get your hands dirty, right? Because it actually is protective, and it makes a lot of sense that you're getting that, now that you've explained that skin microbiome, how it would have such a positive effect.
Yeah, if people are going out for walks, try to go out for walks without any of the things on the skin that we normally would have, right? Our makeups and this, that, and the other. Of course, if it's super sunny, you're going to need some sunscreen on there, but nonetheless, try to go out with as clean skin as you can.
Great. If people want to learn more about this, can you share where they can best find more info from you or in your education and products?
Yeah, so a couple of places. So I put a lot of education on the skin microbiome on my page called SivCare, SIVCARE. That's the Instagram handle. And in fact, Siv also has a skin microbiome free course that we have on YouTube, right? So people can just follow that as well. And then of course my personal Instagram, where I share a lot of this as well, is KiranBiome, KIRANBIOME.
Wonderful. It's been great to have you on again.
Thank you.
Thank you so much for joining me today.
It's my pleasure.
Thanks for joining us on the Dutch Podcast. Join us every Tuesday for new conversations with leading functional health experts. If you like what you've heard, be sure to like, follow, and subscribe wherever you get your podcasts.